Andropause is a condition in men usually above the age of 50 where there is a gradual decline in the male hormone testosterone levels in the body. Because of that, they experience certain physical problems like irritability, depression, loss of muscle volume, loss of strength, fearfulness, insecurity, etc., etc., etc. Coming to sex, they lose the desire for having sex because it's the male hormone which gives the man the sexual drive and desire. When those levels are reducing, automatically the drive and desire will come down. The difference between a menopause in a woman and andropause in a man is that in the woman there is sudden stoppage of the production of the female hormone estrogen. In the male, there is no sudden stoppage of testosterone, but only a gradual decline over the years. That's the only difference. That is why people cannot recognize that easily that they are going through andropause. The medical word for andropause is late onset hypogonadism. Hypogonadism means reduced levels of the male hormone testosterone. It can occur in any age group, in the middle age, in the adolescents, in the adults, youngsters also. But when it happens in the late adulthood, as I mentioned, 50 plus years, then it is called late onset hypogonadism. Now, diabetes is a condition wherein the blood vessels in the body get affected because of certain byproducts of uncontrolled diabetes. These products are known as advanced glycation end products or AGE. When they accumulate in the body, because diabetes is not being properly controlled, they will affect the proper functioning of the inner lining of the blood vessel. And this results in what is known as endothelial dysfunction. When the blood vessels are affected, the amount of blood flowing to the penis also will reduce, so the man may get erection problems. Apart from that, the diabetes can affect the functioning of the testes. The testes which produce the male hormone testosterone. There is a condition called diabetic testes because the blood vessels in the testes also get affected due to uncontrolled diabetes. And when those blood vessels and testes get affected, the blood flow is not adequate to the testicular tissue for their proper functioning. So they develop a condition known as diabetic testes, which also reduce the production of the male hormone. On the whole, it is the reduced levels of testosterone in the man, in an elderly man, that causes the loss of desire and loss of drive. This is very important for us to understand. So, what can be done for this? One, the person must be made to understand what is happening to him. Then, diabetes must be treated properly, adequately, so that the damage to the blood vessels is minimized. And if necessary, if there are no contraindications, the man can be instituted or he can be given testosterone supplements. These testosterone supplements are available as oral capsules, injections, or gel. The most comfortable one, easy to use, are the oral capsules. But before prescribing or taking the testosterone supplement, it has to be made sure the man does not suffer from enlarged prostate, a gland below the urinary bladder, and he has to be made sure that he really has low levels of testosterone by a laboratory investigation. Only then there is no contraindication he can be given, and that can be done. Proper diet and exercise along with these medications will go a long way in alleviate the problems of testosterone deficiency known as andropause or late onset hypogonadism.